Hey everyone, welcome to our research webinar put on by the Canadian Coalition for Homeopathy. We're pleased to have you at this third installment of an ongoing series of very exciting presentations. If you want to put in the chat where you're from, where you're listening from, we'd love to know. Feel free to put that information in the chat. Anything else you'd like to say to start off this evening? And I'm going to start with just a general introduction to the coalition. But first, tonight's webinar, the reason you're all here for a presentation entitled Pediatric Mental Health and Research in Homeopathy by Dr. Arya Mohan. And more on Dr. Mohan in just a minute. But first, about the coalition. So the Canadian Coalition for Homeopathy launched in April of 2022. And the mission of the coalition is to bring together patient associations, homeopathic practitioners, researchers, industry stakeholders who wish to promote homeopathy in Canada and preserve the freedom of choice in medicine. And so it is a national organization, and our ambitions center around these goals, these aims, to make homeopathy a household name and to bring awareness to the fact that there is very robust and exciting research that's being done in homeopathic medicine. And that's one of the primary goals and purposes of the research webinar, which we have our third session of tonight. Our objectives. The coalition strives to educate the public on the many benefits of homeopathy, to debunk false information, misleading information about homeopathic medicine, and to dive into research supporting the efficacy of homeopathy, and to defend and promote the access to homeopathic medicines in Canada. And all of these issues are certainly very important and very pressing. So we are in times when, there's definitely a need to be devoting a lot of energy to these goals. And as I mentioned, this is tonight the third installment of the research webinar series. And for your information, we have many exciting presentations that are scheduled for 2025, and you can see them listed here. And Sharam wanted to speak actually about the HRI, which is an important institution, Homeopathic Research Institute. And so perhaps, Sharam, you could say something about the HRI and the relation to the research webinar series.
Thank you very much, Victor. Good evening, everyone. Maybe I can share my screen as well and take you to the Homeopathic Research Institute's website. This is a very important website in the homeopathic community. The primary goal of the Homeopathic Research Institute is to raise funds and conduct as many researches as possible, but also review researches that have already been done in homeopathy and publish the ones that are the most robust in. So I'd like to invite you all to go through this website. The website is HRI and then research.org. Once you go there, there are a lot of materials that you can look at, quite a few videos. The most important part on the research is that under the HRI research, you can look at the current projects and informing new researchers, learning from day-to-day practice, learning more from existing evidence, and so on. And when you go through the completed projects, you can see some of the researches that have been done and published here. There is one on ADHD case series following the treatment of 20 children as well here. So just want to invite you to go to that website, look at the resources, look at the events that they're going to have, and follow some of the current projects and research strategies, completed projects, and so on. So let me stop sharing here.
Wonderful. And before we introduce tonight's presenter, I will just direct your attention to the Coalition website, which is continually being updated. And so you can see the website here. The articles and research page that we have started is the place where you can find previous installments of the research webinar series. So Sharem's presentation, Unlocking the Healing Potential of Homeopathy, Debunking the Placebo Myth, and the webinar that we had last time with Jennifer Jacobs called Clinical Research in Homeopathic Medicine. And both of these webinars are definitely to be shared with your colleagues, with your patients, with anyone who's interested in homeopathy. And they really lay a solid foundation for understanding basics of homeopathic research and various issues and problems within the domain of homeopathic research. So, with a accumulating body of presentations, we'll have really a living archive of material brought to you by some of the best homeopaths and homeopathic researchers currently at work in the field. So please do stay up to date with what we're doing with the research webinar series. We have a number of articles that are being published on the Coalition website as well. So the best way to stay in touch with us is to subscribe to our newsletter, which you can do on any of the pages on the website. And you will see that there is the option to subscribe to our mailing list. And you can also find us on social media, where you'll be able to stay up to date with our offerings and important news and events. So with that, perhaps you'd like to introduce tonight's speaker, Shrem.
Thank you very much again. Yeah, it's a really great pleasure to introduce you to Dr. Arya Mohan. She's a licensed homeopath at Grand River Homeopathic Clinic in Kitchener, where she has been practicing since 2023. She holds a Bachelor of Homeopathic Medicine and Surgery degree, as well as 3 years of postgrad training in homeopathic psychiatric from India. In addition, she has earned a Master of Philosophy degree in behavioral medicine and rehabilitation, specializing in the treatment of mental health challenges such as autism, intellectual disabilities, ADHD, anxiety disorders, and other behavioral disorders. Arya has collaborated with multiple mental health organizations and served as a senior research fellow at the National Homeopathic Research Institute in Mental Health. Her mission is to provide compassionate care and holistic healing, enhancing the quality of life for her patients and the broader community. Please join me to welcome Arya to our panel tonight, and we're looking forward to hearing you, Dr. Mohan.
Thank you. Thank you, Shram, for the introduction. Yeah, I'm glad I got an opportunity also to talk and interact with fellow homeopaths. All right, so not further waiting, I'm just sharing my screen for the presentation. Yes. I hope you're able to see that.
Yes, it is.
Okay, all right. So first of all, happy World Children's Day. So it's today. So let's celebrate every child within us. So not just our children. We all hold a child within us, and we should hold and we should encourage them. So it's for everyone. So once again, I'm just wishing. So let's going on to our today's topic, which is the pediatric mental health and homeopathy. So I just, when we talk about this World Children's Day, we cannot ignore what are their problems also they are facing in this current world. Like if you can see that there is a 1 in 5 children and youth in Ontario has a mental health challenge, and about 70% of mental health challenges have so I'm just keeping it down. Yeah. So 70% of the mental health challenges have their onset in the childhood or youth, which is very much needs to be given attention to. So therefore, the early identification and intervention is very crucial and can lead to the improved achievement in their school and in their better outcome in the life. So when we talk about all these things, but we need to know how a child grow. We all know about their physical growth. Like they are after the giving birth, they will crawl, they will start walking, and we are only focusing more on that. But there is another part of the child which is very important, which is a mental and emotional development of a child. So we need to, when we talk about the disorders, we need to know how it is developing and what are the factors which is affecting their mental and emotional development. So beginning with the nature and nurture theory, which is a very famous and very controversial theory, so which has been also called as genetic and environment. So the epigenetics, we know that that is a recent advancement in the field of medicine. That is, with the advancement of this epigenetics, it has a significant contribution in understanding the gene, how gene and environment is interacting, and how their early experiences are affecting their life. So that epigenetic modification describes a chemical alteration to the structure of the genes without altering the genetic decode itself. So that is what their idea is about. So for example, how that has been explained as like there is a prolonged period of stress during the pregnancy. We all know that we are carrying for 9 months, and the so we are going through lots of stressful time periods. So this early development can produce epigenetic changes in the brain that can control even the body response to the stress. So when a kid is developing, that's not after the birth. So from the fetus, from the womb, when a lady gets pregnant, there itself an emotional development is happening with the child. So if you see that what are the risk factors of the childhood and mental health disorders means that is there is a more categorized which is given. So one is the lifelong, that is natural disasters, physical illness, malnutrition, illness. These are all type of the lifelong causes. So if we see the preconception, that is also carries a very big role in shaping the emotional and mental development of a kid. So which is unwanted pregnancy, inadequate spacing of the child, adolescent pregnancy, consanguinity. And if we see that prenatal and perinatal, it is about the complications during pregnancy and how the oxygenation has been affected for many of the mental health disorders. Maternal cigarette and alcohol uses, in utero exposures to the toxic agents, birth hypoxia, which I mentioned before. So these are the other factors. And if you see the early childhood and mental emotion, so we all know about the later part because we are all focusing, we are all seeing the patients, we are also seeing many people with the same, but we are not focusing much on the before part. But that's also a very important part of an emotional and mental development of a child. So I would like to begin with the antenatal mental health, how the mental health is developing inside the womb of a mother. Okay, so the prenatal period is a critical time for the neurodevelopmental, and we all know about the doctors will be prescribing folic acid, essential nutrients. These are all providing health, physical development, neural development. They're all talking about folic acid is good for their neural development, notochord development, everything. But we are not talking, or we are not more thinking about how their emotions are connected with the mom. You know that when you everyone know that when a mom eats something spicy, the kid is going to kick if the period has been there. So there is an effect in the child. So if the food can induce the sudden reaction, how about their emotions can impact, how much impact they can make it on a fetus, on a kid. So that is a very important period we need to be focusing on. And a range of exposures have been found to exert a long-term changes on the brain development and the behavior with implications of their physical and psychiatric health. So maternal antenatal anxiety and the depression, which is actually a well-studied or studying area in the research, that how the maternal anxiety and depression affects the child. So helps the neurodevelopment of a child, which has a very much risk in their mental development in the future. And so also the elevated antenatal stress hormone, depression and anxiety, antenatal depression and anxiety are associated with their poor emotional adjustment in the young child. So it has a direct connection with the child. So how this maternal anxiety and depression during the pregnancy is being involved in the development of, sorry, I'm just keeping this tag down. Yeah. So how the women's anxiety or depression is been affecting the child, we could see that hormonally. So if we see that the childhood, the exposure, it affects really actually the hypothalamo pituitary adrenal axis, which predicts the attention deficit hyperactivity disorder symptoms in 8 to 9 old in children. This was a research finding. So if we see the genetics, environment, and gene X environment interactions, there is a possibility that some of the risk is connected prenatally via changes in women's mood-based physiology affecting the fetal neurobehavior development, which is called a fetal programming, means where even the emotional mood changes can program a child's neurobehavioral development. Okay, so first thing is maternal fetal HPA axis dysregulation is happening. So we all know that about hypothalamo pituitary adrenal axis, how important that is in the behavioral disorder. And you all know that maternal the mother is connected to the fetus through the umbilical cord. So there is blood vessels are going and the child's the blood is coming to us for the filtration. So it's a lot of physical connection is also happening. So there is a high chance that the stress hormonal transfer is also happening from the mom to the child, which definitely affects the neural development, the brain development of a kid. So the intrauterine environment disruptions due to the variations in the uterine artery flow, which is called, it is creating an arterial resistance. So how that affects the arterial flow is like the stress hormone. We all know that the cortisol is the one which elevates during the time of the stress. So this has an opposite effect in the arterial flow to the kid. So in that, it creates an arterial resistance in the way the blood supply towards the kid is being reducing. So that creates an hypoxic condition in the kid that really affects the brain development of a child. So if a mother with high anxiety, with high depression, stress, PTSD, or whatever trigger is happening in the life of a mother when she is pregnant, it will definitely affect the emotional, mental development of a kid for sure. So maternal psychological distress can affect the fetal autonomic and the central nervous system. So that is a study finding. So how that is affected is HPA axis dysregulation and decreased uterine artery flow and the arterial because of the arterial resistance. So it has been beautifully demonstrated what is fetal programming. So fetal programming is like because we know that mom's half and dad's half of the genes is combining and towards a kid. So there is a gene predominance there, but this can be modified through the stress factors, which is what is called the environment. The intrauterine environment has an effect to that is through the epigenetics. They are changing the genetic expression of a kid. So that creates a new programming to the kid. So that is actually the fetal programming, and it has chronic long-term effects. So the recent reports have emphasized that impact of the interaction between the genotype and the uterine environment. So imprint of these genes also controlled by the epigenetic modifications. I told you how the modifications are occurring, and including the DNA methylation and histone acetylation. So which are the process happening in the epigenetic modification in a DNA. Okay, so this environmental factors and nutrition has a very strong influence in changing this epigenetic expression, which we need to understand. And the pregnancy period is highly crucial for mom and the kid. So this is what which is explained, and this figure really simplifies what I have been explained. So how this was being making a fetal programming. You can see main effects are hypoxemia, metabolic changes, and endocrine changes happening in the kid, which will create a new fetal programming, and the expressions will be changing after the birth. So this is just a piece of interest. Those who wants to more read, they also are really interested in reading. Please go through this. This is a wonderful book. I love reading this book. So I started reading also before my pregnancy. So this is The Secret Life of an Unborn Child. It's a wonderful book. It's available in the hard copy also, like in Amazon to read. So it talks about how the baby inside the womb is connected with the mom, with the emotions, how emotions are affecting the baby inside the womb. It's a wonderful book and worth reading. So this is just a piece of information I just put. So now the baby is born. Okay, so now it comes the postnatal mental health. So this postnatal childhood health includes reaching the developmental and emotional milestones and learning healthy social skills, and also about a child's well-being and ability to thrive. So childhood and adolescence are critical stages in the life of mental health. So because of their rapid brain development. Okay, so because of the rapid brain development, this two periods phases of the life are very important to be, because we know that children are learning. They are learning from they are learning from the modeling. They are seeing us. They are exploring by themselves. So we have to let them learn by themselves. So it's a very crucial period for them to grow. And also the quality of the relationship and environment will impact their well-being, their physical, mental, emotional well-being. So the three developmental theories of the there are different developmental theories. I'm going through the only two important developmental theories of a child, not the three. Sorry for that. So theory of the cognitive development, which is by the Jean Piaget, and the theory of the psychosexual development, psychosocial development by Eric Erikson. So these are the two basic theories which I would like to mention, because without that we will not be, if we identify this process, it is easy for us to identify their emotional disorders, where it happened, what was the trigger. And because it's not just the medicine will help the mental health disorders to overcome, we need other therapies, and we need to help, we need to have a parenting session, because this all contribute a wellness of a child. So in order to see that, you need to see how a child is developing, how an mental development of a child occurring, and what are the triggers where the emotional dysregulation happening. So if we see that there are 5 domains for a child in their development. Okay, first is the physical, which you all know that we are seeing them like growth and development of their body, physical body, and the cognitive is that thought, memory, and learning of a child, how they are developing. And communicative domain is the language and speech of a child, and socio-emotional is how they build the relationship and how they are reacting to their social cues. And of course, the adaptive skills, adaptive domain, which is the self-help skills, like they are learning to dress by themselves. So it's all about. So these are the 5 main domains of development of an early childhood. So if there is any issue happens in this, you will see the disorders in the future. So this is just a pictorial representation of same, and these are overlap. This can be overlapped. This will interact definitely. So it is the same concept only, but it has given in a diagram. That's all. So first we will see what is the cognitive theory by Jean Piaget. First of all, Jean Piaget is the father of developmental psychology. So he is very interested in the childhood mental development. So I cannot mention him with. I cannot go without mentioning him, because he had given a lot of contribution. And based on his theory, we are using one of an application assessment tool based on his theory. I will come to that. So cognitive theory is basically it attempts to explain the human behavior by understanding your thought process. So it focuses more on the thought, which leads to the emotion, anxiety, behaviors, etc. So the distorted thoughts and negative thoughts are the maladaptive behaviors. Okay. So Piaget says that he's dividing a childhood into different stages. Okay. I'll go directly to that. I'm not complicating anything. So I'm just mentioning those who are interested, you can go read the theory. So these are the different stages of the cognitive development according to the Jean Piaget. That is sensory motor stage, which starts from the 0 birth to the 2 years, where the babies start to understanding the world through their touch, grasp, watching, listening, and all. So through this, they begin to start the sense of the object permanence, because we will say object permanence is nothing but if the particular part object is not in front of the kid, he understand that there is nothing, that object is nowhere present in his world. So that is object permanence, which means they understand that object exists when they cannot see them. So the next stage is the pre-operational stage, which starts from 2 to 7 years. So it also mentions about the language development and abstract thought. And this means that they can think about the concept and ideas. So this is best explained by their imaginary play. This is this phase where the kid will start doing lots of imaginary plays. They will pretend do something and all. So this is the phase. So they are putting their brain, their development and their abstract thinking, their language and all towards the to making their own concept. So we have to lead them to leave them, or we should let our child to do all these imaginations, and you have to encourage such imaginations also. That is also their normal development. Then next one is the concrete operational stage, which is from the 7 to 11 years. The children will start thinking the logical. This is kind of a complete questioning stage. What is this? Why is that? Why you say this? Why you say this? So like that's where the practical phase you all see in the kids. Like in the 7 to 11 years, they will start questioning everything. But you have to sit and um, patiently and need to have a conversations on what they are logical, what are they thinking. So they will have a lot of questions. So you have to give time to interact with them and to correct their maladaptive thoughts and all. So next one is the formal operational stage, which is beyond 12 years, where they'll be like kind of very logical. They will try like kind of new things, and from that they will learn. So there are lots of learning happening in this beyond 12 years old. So these are the basic 4 phases. And one of this is what is the application of the Jean Piaget's theory. Most of them are using this to assess the kids, the disorders in the which are coming in the clinic, right? So it assesses actually the child's cognitive, intellectual, motor. So I don't have to explain because you're all aware of these things. So whether the kid is looking into your face, is he crawling, is he started talking, like when is he started using a full sentence, and he's running, or is he exploring and playing and all. So all these things are based on Jean Piaget's cognitive theory. So this is an application which we are all using to assess the childhood disorders. And so coming on to the topic, like mental disorders during the childhood, so I would like to categorize it as like cognitive disorders first. So cognitive disorders, the main symptom of the cognitive disorder will be the intellectual dysfunction and also maladaptive behavior. So intellectual dysfunction, you can see that IQ will be low. They cannot learn. They might have problems with learning, reasoning, making decisions, problem solving capacity. These are all low. If the kid is coming with these symptoms, you have to understand they have issues with the cognitive aspect of their kid. Then adaptive skills, that is also about they will not be able to communicate properly. They are not able to do fine motor things, gross motor things. That's also another thing which is more concentrated on their cognitive development. So these are the basic expressions of cognitive disorders. So if we see that the early signs of cognitive disorders are rolling over, sitting up, crawling in the late stage, poor eye contact, talking late or having trouble talking, slow to master things, potty training, you know that like using that tool, it is easy to assess. So these are the symptoms where you will see in the patient in your clinic with a kid coming with difficulty to remember things. They start said he's drooling and he's not talking properly. These are all the definitive signs of cognitive decline, cognitive disorders. So some of the major cognitive disorders we usually see in the clinics are attention deficit hyperactivity disorder, autism spectrum disorder, dyslexia, intellectual disability, learning disability, reading disorders. So when you get these things, you have to back read the things. So you have to definitely ask their pregnancy phase. What are the stressors they were using? What are the stressors they were having, and how they managed it? This definitely have effect on this kid. So according to our homeopathy case taking, you all know that our case taking itself is a very wonderful, elaborated process where we consider every aspect of a women in case of a pediatric case. We are considering the how they have conceived, whether it was a planned one, see how significantly it was been, how wonderfully Hanneman has been constructed our case taking, considering every aspect of the development of a child in 18th century. So how genius he was really. So the second theory, which is the Erik Erikson's psychosocial developmental theory, which is one of my favorite theory also. So whenever an emotional disorder comes towards me, I definitely look into this theory. I really try to connect to this theory, like where the kid has been really struggled with, where the fixation happened. So I really love this theory. So this is by Erik Erikson. He's also a psychologist. He developed the psychosocial developmental theory. You all know that, you all might have heard about Sigmund Freud. He's a father of analytical he's a father of analytical psychology, analytical theories. He had been psychoanalytical theories. So from his concept of psychosexual development, he adapted some of the concept and made his own theory as an Erik Erikson psychosocial developmental theory. So it has a base on Sigmund Freud's many concept. So Erik Erikson theory was based on what is known as epigenetic principle, which means the people grow in a sequence where occurs over the time and in context to the social community. So he have given importance to the social environment and social interaction also towards the development of a psychology, mental development or emotional development of a kid, which was not considered in the cognitive theory by Jean Piaget. He didn't consider the environment and social interaction, but he just considered the growth and development of a child is only coming from the internally and the self-exploration. But Erik Erikson considered the social aspect also to the development of the child, mental development of a child. So according to him, the individual go through 8 stages of development in this life. So each stage include a developmental task that puts to the individual in a challenge or crisis. He used the word crisis. So each challenge or crisis is a turning point, which create an vulnerability also, and it has a and the potential of that kid will be enhanced. So the more successful a person overcome one phase to the another phase, the more healthier his psyche is. And whenever he's stuck in a phase, you will see the expression of that phase. So I can explain you more clearly through this phase. So these are the 8 phases of a development of a kid. So which is trust versus mistrust, which starts from the birth to 18 months. You know that there is a lot of trust and connection happening during the breastfeeding. That this is the intense time period where we breastfeed the female. So that through the breastfeeding and through the play happening there, talks happening there, we all now encouraging about the baby talks, and also through them they are developing a sense of trust and security. So that is very important during the first phase. So if there is anything happen there, it can create mistrust. So I'll explain you how this has been negatively affect a kid and how it will develop a psychological issue in the future. So first stage is trust versus mistrust. Second one is autonomy versus shame and doubt. It happens during the 1.5 years to 3 years of age, where they want to create, they want to explore everything by themselves. You all know that I have also a 3-year-old. She wants to do everything by herself. If we help something her, she will undo and do by herself. But we have to let them do. I know it's a lot of time, patience taking, tolerance taking process, but it's their normal phase. If we help them, over help them, they will develop a kind of doubt on themselves and will develop a shame on themselves. That is what autonomy versus shame or doubt. So they will always doubt their own ability. Am I not able to do that? Why are you helping? They don't know to question that, but they always feel that kind of introversion or low self-esteem and low confidence in that phase. So you have to let them develop their emotional abilities on that particular phase. And comes the initiative versus guilt. That comes from the 3 to 5 years. that's the stage where they have the self-confidence. They will try, okay, usually this phase kids, they will say, okay, I will start, okay, I will this, those. They will say, or they will show lots of initiativeness in their classrooms, in their among their friends. But we will say, no, 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 you don't have to do that. She knows that. No, we should not do that. So he says that he have to let them try that. So you should encourage their initiativeness. Otherwise, they will feel more kind of guilty in all their decisions. So they will become very indecisive in making decisions in the future. They will really struggle making their own decisions in their future. So industry versus next phase is the industry versus inferiority. Industry in this phase, they like to work. So in this is 5 to 12 years is they want to help everything with if it's a boy, he wants to help dad. If it's a mom, they will come and help all everything. And so you have to let them do work by themselves. If you didn't let them do, or if you interfere the things, of if you over control them, they will definitely feel inferior. They will feel like, oh, she doesn't trust me, or I'm not good as them. So this is where lots of parents also use comparison. See, why can't you do like her? Why can't you do like? So that's a very bad thing. So it will create an inferiority within them. So they will so if they are industry, if they are really good in their thing, if they successfully overcome this phase, they will feel kind of pride, and they will accomplish a lot of things in their life. Next phase comes the identity versus the confusion. That comes from 12 to 18 years. There it's a strong sense of identity and a clear picture of the future, where they will be feeling themselves like kind of a achiever and all. So that's where in this phase it is more kind of identity. They will be searching for more on their identity. So if that stage is being accomplished well, then they will feel a strong sense of identity, and they have a clear picture of their future. Then comes about the intimacy and isolation. This is the phase everyone will start finding a partner, a kind of a for a relationship. They will crave for a relationship in order to feel a security. So if they will succeed in this phase, they will feel as safety in this relationship and fulfilled with commitment and love. And if it has been not fulfilled, they will feel isolation. Next phase is the generativity versus stagnation. It's kind of a more adult phase, 40 to 65. Their desire to give to the family and community and succeed in their work. And the last phase is integrity versus despair, which is the final stage of our life, like over 65 years. There will feel a sense of achievement. Those people who are not feeling achieving this phase well, they will feel despair and emptiness in their life. Most of them feel like kind of a suicide and all. So we all know that nowadays lots of gray suicides are happening a lot, like old age suicides can also happen if they didn't feel their previous phase not happened well. So further to add on this, what are all phases needed in each phases? So this stage one, trust versus mistrust. The kid really wants the warmth, comfort, healthy parental attachment is needed. So whenever you will see there's a breach in this requirements, you will see anxiety disorders, fear, mistrust. The kid, lots of separation anxiety is one of an expression of an emotional disorder in this phase where the people will be stuck. So if you trace back their history, you will definitely find a fixation factor in any of this phase. So that's how the beauty of Eric Erickson's theory. I love that. So it will never go wrong if you analyze it correctly. So in order to know that, we need to find the 8 phases of this emotional development of a kid. So I'm not going to explain too much. So it is just opposite of that. So I will leave you to read on this. Now we need to see the psychosocial disorders. What are the psychosocial disorders which are commonly seen in the or coming in the childhood? So one is the addiction and substance use disorders, which comes at alcoholism and drug, drug addiction. And about the anxiety disorder, there are panic disorders, generalized anxiety disorders, post-traumatic stress disorder, and obsessive compulsive disorders can be seen also in the childhood as a psychosocial disorder. And also you can see that mood disorders as like depression and bipolar, eating disorders like anorexia and bulimia, psychotic disorders such as schizophrenia, and behavioral disorders as oppositional defiant disorders and conduct disorders. So these are the major psychosocial disorders. So if you see any of this diagnosis which is coming in your clinic or approaching you, you have to be traced back on their phase of this 8 phases of their development. You will see where they will get a fixation. So fixation is nothing but that term has been borrowed from the Freud's theory. So fixation is nothing but basically stuck. There is a stuck feeling in any of the phase. The kid will definitely express the expressions of that face. So if you get anything you trace back, you will definitely find a cause, a trigger in their phase of their emotional development. And there are some certain early signs of their mental disorders in the child are getting significantly lower marks in the school, avoiding friends and family, and having frequent outbursts of the anger, challenges to sleeping or eating habits, acting out or showing rebel, drinking a lot, or using the drugs, not doing the things they used to enjoy, worrying constantly, experiencing frequent mood swings, concerned with his or her appearance, obsessed with his or her weight, lacking energy or motivation, increased risk-taking behavior, feeling very down. So this symptoms can be also very normal in their changes of their each phase in their while they grow. This emotions can really vary like kind of up and down, but we need to be more concerned on these symptoms when they are intense, when they persist over the long period of time, when they're inappropriate for their child's age, and they when interfere with the child's life and the relationship. If these things are happening with those symptoms, we need to consider, and that needs to be given most attention as early as possible. So from that, the warning signs of a mental disorder. So if the below mentioned symptoms are there, persist, then it is sure that the kid needs a medical attention. So one is a sadness that lasts 2 or more weeks, changes in being social and staying away from others, hurting oneself or talking about hurting oneself, talking about death or suicide, having outburst or being very moody or testy, out of control behavior which is harmful, big changes in their moods and behavior and personality, changes in their eating habits, loss of weight, trouble sleeping, complaining of headaches and stomach aches often, and skipping their schools, doing poor in their schools. If the symptoms are really showing in the kid, they are the warning signs of some underlying emotional or mental disorders. Now, what is so these are the things which we talk about, how we early identify the symptom mental disorders of a child. So what are the benefits of we are identifying these things? Because of their timely intervention to reduce the stigma and to improve the diagnosis, and also it is very cost effective. So so if we are resolving a mental disorder as early as possible, it will save your huge money and of course your mental well-being. Now to the main topic, like what is the role of homeopathy in mental health, what we can do in these things. So in homeopathy, we all know that we have lots of medicines. We have lots and lots of medicines. So, but if you see the analysis of medicines, it doesn't only cover the disease symptom. Each drug analyzes the mental, physical, and social aspect of an individual. That itself is a very big sign that it can be better applied in the mental disorders. So homeopathy case taking also involves a very in-depth analysis of an individual life, disease, including the family medical history, which gives an idea about their one's genetic predisposition itself. So antenatal history, birth history, developmental history, and so we will know that the evolution of symptoms. So from if a properly taken case, we all know that in the organoid is a very famous quote, which is well taken cases half cured. So if we take a case really well, we will correctly identify what the problem of the kid or person is. So that itself will give a very big relief in that case. Now we have to just focus on that. So how Hahnemann has been wonderfully constructed the case taking procedures. So I should be saying thanks to him. So homeopathy is interested in identifying the sick. So this is, we all know that J.T. Kent, James Taylor Kent, he's also a renowned homeopath and he's a pioneer. So he developed the concept of sick. So sick is not just a physical symptom, a person with not just a physical symptom, but also having an internal feelings. So according to me, he says that the disease starts from the mind. then only it start then appearing in the physic. So that is also kind of an eye opener in mental diseases. So they will coming, sometimes they won't talk anything. I don't have an issue. I don't have an issue, but they keep coming with the same physical disorder. That itself is showing that the disease is not existing outside. It is existing from inside. So how well he have also explained about how the sick. So, and that's also we are, with the help of that also we are individualizing each cases. So J.T. Kent has also stated the following hierarchy of the mental symptoms. So will and emotion, which is nothing but the cognition, the cognitive aspect of a kid or a person should be given first importance. The concerns and the reaction to the external stimuli, like his loves, hates, anger, desire, emotional levels should be given the first importance when you take the mental generals. Then comes the intellect and their understanding, then comes their memory. So this is the hierarchy of the mental symptom by J.T. Kent. So when you get a mental case with a mental symptom, this is the way you have to give the weightage to. So any alteration in this basic functions will create signs and symptoms. And also when we deal homeopathically a mental disorder, we have to always remember that there is an interrelationship between the body, mind, in a health and disease, especially in mental disease. So we have to give equal importance to the physical symptom, corporeal disease symptoms, along with the mental symptoms. So this only together constitute a perfect remedy or a perfect solution for a mental disorder. And I cannot ignore the miasms, because Hahnemann has been studied the chronic diseases for 12 years in depth. So he published 4 volumes of chronic diseases, which was wonderfully explaining about how a disease is developing. So he published the books from 1828 till 1830. So there are 12 years of the study, and he published in the 4 volumes. Those who are interested, go read them. Go read it. It's a wonderful book. He explained about how the evolution of chronic disease happened. So through that only the discovery of miasm happened. So which is the fundamental cause of a chronic disease. So he actually told about the SORA only, but eventually we got 3 more, one which is psychosis, syphilis, and tubercular miasm. So I'm just only quoting the 3 mental symptoms of this miasm, because in order to the miasmatic remedies can modify a disease, a chronic disease. So we all know that mental diseases are mostly the chronic in origin. So a miasmatic remedy is paramount in treating this emotional or psychological disorders. So in order to know that, you need to understand which miasm they are presenting. So if we see that the SORA, the most predominant symptom of the SORA is inconsistent. The patient will be, so most of the anxiety symptoms falls under the SORA, and they need most of the antisoric remedies. So inconsistence, impractical thoughts, hyperconfidence are the main images of this soric miasm. So you can see that all the anxiety, all the fears comes under this soric miasm. And if it goes to the psychosis, it's an avaricious or overgrowth of the thing. So everything is hyper there. So every incoordination, jealousy. So incoordination you can see everywhere. The people will be some kinds of, even if they are emotional, they will be like clumsy. They will do everything messy. So that is kind of a psychotic expression. So I have just only put the gist, but if you see, this is being taken from the Subrata Kumar Banerjee book. It was very well explained how the miasmatic symptoms has been classified. So it's just a gist of that. So if you're interested, you can go read that book also in order to know the in-depth of the miasmatic symptom, how I identify it in the practical way. So the next comes the syphilitic miasm, which is the main idea or the main concept of that idea is destructive. So destructive mentality, you will see that in their physical sphere also, and also in the mental sphere. So you can see that most of mental perversions, deformities, all the vital sense of their judgment, memory, everything, but they will be very intellect. They will be very keen and very sharp in their mind, but they are very destructive also. So that's a syphilitic miasm, where most of the anti-syphilitic remedies will help definitely in that mental disorder cases. Next comes the tubercular miasm. Tubercular miasm is actually the mix of SORA and psychosis. They are together developed into a tubercular miasm. So the main theme of that miasm is dissatisfaction. They will be never get contented, never get satisfied in anything. Most of the kids toddlers fall under this miasm, because that's a phase where they'll kind of anything you give, she says that I want this, I want that, but if you give that, they will refuse. So most of the kids will come into this tubercular miasm in common. So that dissatisfaction and the lack of tolerance are there most common predominant feature. So the kids desires that this and those, but if you give them, they reject them. So and we also see that lot of tubercular miasmatic kids in this. So in order to completely treat treat a mental case really well, you have to understand their miasmatic basis also. So that is needed. That's why I included that portion. So coming to we came to the end of this session. So in order to take, so how much I know that homeopathically treating a mental disorder is not as easy as treating a physical disorder. You have to have a clean idea on what you are treating and what we are looking into, and from where we have to start analyzing our case. So in order to have that idea, you should have knowledge of the disease, knowledge of medicinal power, knowledge of the drugs and the disease, choice of the remedy, knowledge of pharmacy, postology, how to repeat, and what are the obstacles towards the. These are all we should. If a person is thorough in this knowledge, he will definitely successfully treat a mental disorder. So before winding up, I would like to say that there is a proper case taking, administration of suitable simillimum at the suitable interval in suitable potency with a proper follow-up of the case will definitely lead to the improvement of mental disorder in homeopathy. So that's all about that. I just wanted to mention I have done MPhil in behavioral medicine and rehabilitation. During that time, we have to do a thesis. So this was my thesis. It is an analytical study on the homeopathic medicines in the management of conduct disorder. So it was a wonderful, I would say that I learned a lot during this phase. It was a 7-month study. That itself is a short period, but I could see a lot of wonders of homeopathic medicines within the 6 months. Within this 6 month of phase, because last month was analytical phase. So in this 6 months, I was being directly exposed to the kids with the conduct disorder. And so it was an analytical study. As I was a student, I was not able to give the medicine. So I can observe and I can analyze, I can take the notes, I can take the data, but the physician was someone else. So the idea is this was being happened, the case taking was happened in the rural health centers where we will get the referrals from the schools, especially from the government rural area schools, where they will have lots of behavioral disorders like lying, kicking, lots of aggressions. So such people's kids will be referred. So they each public health centers, dispensaries have a psychologist. That's the best thing. So there is a psychologist and also a visiting psychiatrist. So it's a multidisciplinary approach. So I studied in the kids from the age of 4 years till 12 years. That was my study age. So the objective of my study was effect of homeopathy medicines in the individual symptoms of the conduct disorder. So there was a psychologist was the one who diagnosed the conduct disorder. So after being diagnosed as conduct disorder, I took the students or the kids, and the doctor was analyzing the case according to our basic homeopathic principles. And she gave the medicine and she analyzed and she followed up every month. And the final, and we included the teacher's report, psychologist report also as a prognosis, how the disease is going, how our treatment is going. So we have included that also in our study. It was easy to collect all these things because all was provided there. So after that, the study results was this. As you can see that we analyzed the destructive tendency, disposition to lie, disposition to steal, cruelty, sexual acts, and truancy, which means avoidance of the school. We analyzed this. As you can see, we could see the significant reduction in their symptoms in 6 months. So this was a shorter study. A 6-month study is a shorter study for mental disorders. But I would like to follow that, but because of my short period of time of my course, I have to stop there. But we could see wonderful changes in within 6 months with the wonderful homeopathy. So I really thank this opportunity to study the effect of our homeopathy medicine in the conduct disorder, which is really tough to maintain. If you, according to the parent, also according to the student, there you will see a lot of impact everywhere in that student of that student. So I just included some of this is for your reading. I'm not going to explain because we don't have much time. So these are some of the well documented quality studies of homeopathy in mental disorders of pediatric section. So I have given every details of it where you can access the headings of the study, and you can go through that. And those who are interested, please go and read the studies. They are well documented and well studied cases, and these are all published in the peer-reviewed index journals. So please go through it and see that how our medicines can help our children before being diagnosed into some other disorder. So we definitely have a role in their life. So as a takeaway, so the first few lives, especially of their basic foundation upon their future learning, health, behavior, and development. So early emotional health is a foundation for their lifelong health outcomes. So human brain is a plastic and ever changing based on our individual experiences. It is never too late to make investment in improving the emotional development of our children and importantly us. So I have included my references. Yes, so that is about the presentation. It comes to the end of the presentation. Yeah, so any questions are open?
Great, thank you very much. And if anyone has any questions for Dr. Mohan, you can please put them in the Q&A section and we will address your questions.
Yeah, I saw that question in the chat, which was the book I mentioned about the miasm. It is by, I already included that in my reference. Um, Let me see the exact name of the book. It is Miasmatic Diagnosis, Practical Tip and Clinical Comparison by Subrata Kumar Banerjee. That is the name of that book, miasmatic book. It's a very wonderful book and worth reading, and it's very helpful in our practice. Yeah, I think book name. Okay.
So we have one question asking if you have specialized in this field, or I'm not sure exactly if they wanted to know something specific about the area of specialization or if this is what you specialize in.
Yes, I did 3 years of residential training in psychiatry, which is on homeopathy, that back in India. So it was a recent addition in the specialty of psychiatry. So I think it was introduced in late 2000, somewhere like 2007. I guess that's when the first batch of homeopathic psychiatry was passed out. So I was also a recent batch. I passed out in 2019 from it was a very wonderful study. We get the practical learning. We get postings, and we are studying the homeopathy more deeper in terms of psychology, and we are learning more about the organ of medicine, their miasms, and how it has been connected with the psychiatry. But we are also following the same curriculum as a basic from the psychiatry. Like we are also following the Kaplan and Sadok's, where the conventional psychiatrists are using. Yeah, but the pharmacology, which is purely homeopathy. Yeah, I did that specialization. Yes. I think they want to know about autism. Yeah, I'm not particularly specialized in autism, but to be honest, I worked with autistic kids. I didn't exactly started working with them, but back in India, I used to work with autistic kids, and we definitely have. When I was working as a senior research fellow, we have studies on autistic kids also, but that is under evaluation for the publication. Yes, that's the specialization in the autism. Yeah. Not just only specialized, but I also see autism in my clinics.
Okay, and last chance for anyone to ask any questions or any points of clarification before we wrap up this evening. Okay, excellent. So thank you again, Dr. Mohan, for this very interesting and engaging presentation. We may have a few last comments coming in here. Oh, there's people thanking you. Yeah, for the presentation. Okay, so as a final reminder, this is part of a series of webinars that the Canadian Coalition for Homeopathy has put on. And we have a number of exciting presentations that are booked in the months ahead. You can see them listed here, and you can also see them listed in more detail, along with the registration links on our website. And our website is visible here, homeopathycoalition.ca. And there you can, as mentioned, sign up for our newsletter, keep up to date with what is going on with the coalition, news and events. You can also consider making a donation if you would like to support the work of the coalition. It really goes a long way. And so with that, I want to thank you for attending tonight's presentation, and please do share the recordings with your colleagues, with your friends, with allied medical professionals, anyone that you think would like to learn more about homeopathy and various topics in homeopathic research. And with that, wish you all a very good night.
Good night. Thank you all. Thank you so much.
Thank you, Victor. Thank you, Arya, for the wonderful presentation.
Thank you, everyone.
Thank you, everybody.
Sure. Yeah. Good night.
Good night.